Welcome to this screencast on the Infectious Disease Screening and Immunisation Programme for healthcare students in UCC. Let us help you protect yourself and, more importantly, your patients as you go about your university life. You will have received in your offer pack the immunisation and medical forms. These must be completed by your doctor, and they will contain details of your MMR history, your hepatitis B status, whether or not you've had chickenpox, and your BCG or tuberculin skin test or X-ray status. You will only need to have blood taken with results appended if you have not had chickenpox or if you are a dental or a dental hygiene student. And remember, you must sign the forms, and these must be forwarded to us in the Student Health Department. Sometimes it can be difficult to get your complete immunisation records. We suggest that you look in a number of other areas if your GP does not have these. Perhaps your last GP would have these, or for the BCG they may be available from the hospital where you were born. The school records may include details of an MMR booster, and you may also check at your local HSC health centre. This will greatly facilitate us in deciding what vaccinations you need, and we encourage you to make an extra effort if your GP is unable to find them. The GP will also complete details of your medical history. Remember, this is confidential and will be held only here in the Student Health Department and will help in your course. You will be aware that a fee of €225 has been payable for completion of this programme, and it is payable at orientation. It is payable by all with only one exception, and that is if you have previously paid €225 whilst undertaking another course in UCC. You will be issued a receipt on payment, and please retain this receipt for future reference. A partial refund will be payable with a maximum of €140 repayable on a sliding scale basis. This is payable once at the end of first year, once we've confirmed that you are immune to hepatitis B. And can I remind you to please collect your cheque when you're notified via email. It's worth, in advance of attending for your immunisations, or once you have attended, to inform yourself just what is involved in the immunisation programme. You can get information by logging onto our student healthcare website, where we have a healthcare page, and on that page you can click the link to the Infectious Disease Screening, Immunisation and Blood-borne Virus Policy. In this policy you will be able to read the regulations and recommendations with regard to your screening and immunisation, and you should sign the last page of this policy and send this back to us here in Student Health. You may also look for other sources, such as the Immunisation Guidelines for Ireland, which you can find through Google. Specifically on Chapter 18, you can get details of what immunisation and vaccinations are recommended for healthcare workers and other at-risk occupations. By using these various sources of information, you will be better informed and understand the logic of the screening and immunisation of healthcare workers. Let's look now at particular illnesses and immunisations that we offer. Hepatitis B is a serious illness which may be lifelong and occasionally is fatal. It is caused by a virus which infects the liver and which is transmitted from an infected sufferer to others via body fluids, usually blood. It's also possible to transmit it sexually. And there are a number of occupational issues relating to the contraction of hepatitis B. The first important one is that an infected clinician can infect a patient whilst undertaking certain procedures. It's also true to say that a clinician can contract hepatitis B from an infected patient. And it's important to state that if you are infected with hepatitis B, hepatitis C or HIV, you have an ethical obligation to disclose this to your treating doctor. Remember, hepatitis B can be prevented, and immunisation is mandatory as a condition of registration unless you are already immune or the vaccine is contraindicated. The vaccine itself is administered in 3 doses at an interval of month 0, month 1 and 6 months, with a blood test on month 7 or month 8 to check your immunity level. If that level shows that you are immune, you require no further boost and you are immune for life. It may show you to be partially immune. In this circumstance, you may need further boosters, up to a total of 4 further boosters. If you are non-immune, you certainly will need a full course of 3 or 4 further boosters. The blood test to check your immunity must be completed at the Student Health Department. You will require to provide valid photographic ID. Of note, the vaccine has very few side effects and is very safe and effective. Let's look now at tuberculosis. Tuberculosis is transmitted by the airborne route and still remains a significant threat here in Ireland, and is, of course, a threat to healthcare workers. The immunisation guidelines for Ireland state all healthcare workers should have baseline MAN2 tuberculin skin testing performed if there is no BCG scar present or no documented evidence of having received BCG vaccination. So if you've not had a BCG vaccination, you will be screened on entry to the clinical environment to make sure that you are not infectious with tuberculosis. If your skin test is negative, then the BCG will be offered. Remember, BCG is therefore strongly recommended, but it is not mandatory. With regard to the BCG vaccination itself, it is known to have limited efficacy in adults, and there is a debate about just how much protection you will obtain. However, all the evidence has recently been reviewed, and it is still recommended for healthcare workers, including students. It should, however, not be given to any of you who already have had the BCG, or who are immunosuppressed on steroid or other immunosuppressant tablets, or immunosuppressed due to an illness such as cancer, Hodgkin's disease. You should not have the BCG if you are pregnant, or if you've had a past history of tuberculosis. It's worth noting that if you do have the BCG vaccination, approximately 2 weeks afterwards, a small lump will form at the site of the vaccination, and this will break down and ooze and scab over a period of many months. This is best managed by resisting the temptation to continually cover it, leave it exposed to the air as much as you possible. If the ooze is excessive, or you develop any lumps under your arm from the accompanying sore, please come back to see us in Student Health. If you decline to have the BCG, it's worth noting that many North American students decline the offer of BCG vaccination. And this is because the management in North America is by detecting the disease early and not by a program of vaccination. In America, therefore, annual skin tests are mandatory, and if a student has opted for the BCG in Ireland, these skin tests are likely to be positive, and if they are positive, a chest X-ray is mandatory. So, North American students who opt for BCG are likely to have annual skin tests with annual chest X-rays. Remember, if you do decline to have the BCG, you should be aware of the symptoms of tuberculosis, which are a cough going on for a multitude of weeks, occasionally productive of bloody sputum, associated with night sweats and weight loss. You should also remember to inform a consultant if you were brought on a ward round to a patient with tuberculosis, indicating that you have not had the protection of the BCG vaccine. And you should also consider having tuberculin skin tests at least every 2 years, and possibly annually if you are working with patients who are at high risk. Finally, you should remember that you also have the option to change your mind later and opt for the BCG, and this should seriously be considered if you ever opt to work in a country where tuberculosis is present in high incidence, such as sub-Saharan Africa. Let's look now at the issue of measles, mumps, rubella and healthcare students. Measles and rubella are a significant risk to patients who are immunocompromised, and in the case of rubella, they are a particular threat to pregnant women. Mumps is less of a threat to patients, but there have been significant outbreaks of mumps in students on campus over the last few years, meaning students have missed a lot of time in college. Any of you who has not had 2 previous MMR vaccines need to be immunised with at least a total of 2 lifetime MMRs, unless the vaccine is contraindicated. As for the vaccine itself, it is a live vaccine, and once again it should not be given if you are pregnant or plan to be pregnant within 3 months, or indeed, once again, if you're immunosuppressed due to a steroid or other immunosuppressant medication or an illness such as cancer or Hodgkin's lymphoma. It is administered subcutaneously, and if required, a second dose is administered 4 weeks later. It does have a range of mild side effects such as low-grade fever, and 1 to 3 weeks later, mini measles or mini mumps may occur in those who've received the vaccine. The good news is that these are mild illnesses, not as severe as the wild illness that occurred when the wild virus is contracted. And the other good news is these are not infectious illnesses, so you are allowed to attend college and you are usually well enough to attend. It's important to remember that you may well contract other infectious illnesses when you are a student. From the infectious disease policy, it is important to note that students who contract an infectious illness should adhere strictly to the minimum period of isolation recommended and must not return to the clinical environment until that period has elapsed and they have recovered from their illness. This is to ensure that you do not return to the clinical environment and pose a threat to vulnerable patients by passing on the illness to them. This can cover illnesses from as little and as simple as influenza to gastroenteritis. It's also worth noting that students should avail of any other appropriate immunisations as and when recommended during outbreak situations. For instance, last year when pandemic H1N1 struck, it was important that healthcare students availed of the opportunity to protect themselves and their patients by obtaining the vaccine. Finally, your attendance at infectious disease screening and immunisation clinics is mandatory. If you do not attend, this will be reported to your head of school, and you may not be permitted to enter the clinical environment until your hepatitis B immunity status is confirmed by the Student Health Department. Many thanks for your cooperation, and I hope by undertaking all the steps recommended in this programme that you, your patients and the hospitals and clinics that you are attached to will be protected from these significant threats. Thank you.